Hey guys, this is DoctorMBT. We're going to be doing a rhinoplasty consultation today. How long has this been bugging you?
I had an unfortunate fall when I was like 21, 22. I didn't get it looked at quickly enough, so by the time I got to a doctor, it was fractured, but it was already set. That's when they were still like breaking your nose for nose jobs. You were out for like a month. This was like 15 years ago. And I remember I had a friend that went through it and she said it was miserable, so I just didn't do anything. It didn't bother me really until like Instagram, when everything's like documented online. And then when I started my business, I had to do like photos for my website and hate any kind of candid photos of myself. And I just hate living like that.
Yeah, totally. Let me just feel your nose. I can feel that these bones are tilted towards me to your right. So it's a little bit off. This one's a little steeper. You can actually see it kind of accommodates my fingers over there. And then we feel the tip support. So your nostrils look pretty symmetric. They're nice and open. They're not narrow. Take a deep breath in for me. They're not collapsing in when you breathe, so you have good support. I'm going to take a look inside your nose. Okay, breathe in. Breathe out. How's that feel?
Yeah, definitely opened more.
Okay, we're going to try this side. Breathe in. Breathe out.
Yeah, I definitely feel the difference.
We have an extra strength nasal strip. If you look at this thing, it's not just like a piece of paper. It has like a bit of spring to it. So just like me supporting that part of your nose up with the Q-tip, this is actually doing it from the outside and using the elasticity and the recoil of this like little piece of paper to pull it back out.
It does work.
So that's like an indication sometimes that surgery can help. Okay, so now we get to do all the fun stuff. We're going to take some photos and then play with it on Photoshop. Soft boxes so that it doesn't cause extra shadows on your nose. Neutral expression. I'll have you smile at certain points. I want you to smile big. Chin up all the way to the sky. I want to see under your nose. Perfect. You can kind of see some of the tilt now. So this is your favorable side. When you smile, you see it dips down a bit.
Yeah.
This isn't a bad view. I think this is like one where it's kind of going away from the camera, so it looks like your tip is elongated.
This is the angle in most of my photos.
Yeah, so if you now look at the other 3/4, it's not going to look exactly the same.
Yeah,
you see, so this is it coming towards the camera, so it makes your tip look really short. Why don't you tell me what you don't like?
I want the tip to be straighter, it's like straight on.
Okay.
And then definitely lifted.
Some people prefer a neutral versus like a scoop, like a more cuter scoop nose type of thing.
Yeah, because I still want to look like me. I don't want to look like, you know, a different like ethnicity or something. Like
totally.
I'm a proud Jewish woman. I want to look like a Jewish nose in a way, but just not that.
Absolutely. Now, it's a combination of maybe bringing the bump down versus bringing the tip out. Here's what I like about your nose. It's actually starting up where it needs to be, right around your eyelashes. So we don't need to do too much to the top part. We could bring some of this in. But you see, it's not just that. That's not going to do it. We have to do something to this tip and rotate it and bring it out. And we may have to do this a few times. We don't really stop until you're like happy with what we see. So this is where it was. These are the changes we made. Honestly, I do like that.
That looks amazing.
So that, to me, looks like a millimeter or so of like convexity.
That I love, even more than the neutral.
Okay, well, there we go. That's why we do this. Like,
so I feel like that still looks like me.
This view really shows you how twisted it can be from certain angles.
I'm feeling really excited. I wish I had this nose today. I don't want to walk out in the world like this.
Okay, so I'm on the way to my appointment. I was really nervous until like yesterday, and that kind of hit me that's happening, and now I just can't wait to see what it feels like to breathe and to not be like, I can't take photos on the right side of my face because my nose curves right. I trust Dr. Bassiri 100%, and I just can't wait. See you on the other side.
I'm gonna like start trending in Tehran. We're 1 week out of surgery. Here's our lovely patient. She looks awesome. Very minimal bruising. Even though we did bony work. She hasn't like had any air flowing through the left side of her nose for years now. So once all the mucus and everything comes down, she's hopefully going to be sleeping better, even exercising better. And then also once this comes off, we'll see how much straighter her nose looks, which is what we're all excited for.
This last week has been pretty intense. It's a roller coaster. The first couple of days were definitely tough. The pain wasn't really that bad. It was just kind of like, oh my gosh, I just went through surgery. 24 hours before getting the cast off, I literally was like itching to get this thing off my face because I'm just dying to see what it looks like.
It wouldn't deprive us of the satisfaction of removing it. This is the tape, so all the sticky stuff will remove. All right, that looks pretty awesome already. Swollen.
It's crazy.
So it's super swollen right now, like maybe 20% of this is gonna go down. But what you see is we took down some of the bump over here, not a lot. She wanted to have some fullness there so she still looked like herself. But what's really important is we gave you some tip support. It was kind of drooping and like hooked before a little bit. Now it's much more solid and straighter. All of this is gonna come down and you'll be left with something a lot skinnier. Over the next few weeks, months, even up to a year, it'll continue to shrink on you. But most of the obnoxious swelling's gone after about 4 weeks.
So crazy. I mean, it does look like what we like.
Yeah.
Wild. I mean, I can't wait to see all the swelling. It already looks amazing. It's honestly, wow, it feels like a dream. Like it doesn't feel real. I was looking at photos yesterday. And I'm like, how's I walking around this like crooked?
This is the on the table. These are some of the markings. She also had a little bit of bulbosity. Also, as far as the bridge, everything above that little purple line is pretty much gone. We're like about 3 weeks out now, yeah?
We're 4 weeks.
You still look very much like you. It's just less distracting from the other parts of your face because it's straighter now.
Yeah.
And how's your breathing?
Great.
Incisions healing. Awesome.
Now I will allow people to sit to my right. And before,
Interesting.
I would never allow any meeting, or date, whatever, to ever be on the right side of me, or any photo to be on the right side of me.
Yeah, do you feel like you're taking photos from more angles than you normally
yeah.
would? Yeah.
I just do feel like more confident and more like less focused on my nose.
Yeah, as we get you standing up a little taller and feeling better about yourself, that's, already huge.
Yeah, I mean, I think it's exactly what I just wanted to look like me, but less crooked me. I think that's exactly what it looks like.
It's good for you. It's bad for business. No one knows that you did anything wrong. You're only 1 month out.
Yeah,
You're
it's
only
crazy.
1 month out. By 3 months, it'll be really, really tapered more.
Yeah, it's really wild how quickly the body heals.
Like, I know it's only a month out and there's still a lot of swelling. Do you feel like you're comfortable going out? Like,
Oh yeah. I honestly, I think after like a week and a half, that's when I was like, okay, like the first couple of days it was fat.
yeah.
And then I was like, oh my God, what did I do to myself? Now, if I had a speaking engagement, like I would have no qualms about it. I even think like after 3 weeks would have been totally fine.
Great.
But every day I feel like I notice it looking a little.
It will.
Yeah, I love it. Thank you.
All right, you're welcome.
I'm so happy. Can't believe it all happened. It's crazy. Like how I've been walking around like this forever. Why didn't I do it sooner? But it all happens when it's supposed to. Okay, it's been 3 months now. It just feels like this is the nose I was always supposed to have. Yeah, you just did exactly what I wanted, and I'm super happy.
So we gave you support, so now it's supported, it's straight. And then we're gonna look at the other views.
That's wild.
Natural.
Wow. That's really crazy.
All right.